Hi, my name is Elena Parham, and for my image analysis project, I chose to do it on a myelogram. Demonstrated here is a radiographic image of a myelogram. You can see the spinous processes, vertebral body, and the spinal canal filled with contrast. After my presentation today, if you don't already know your spine anatomy, you will. You'll be able to define a myelogram, you'll know the setup for a myelogram, and you'll also be able to assist in a myelogram procedure, and you'll be able to evaluate a myelogram radiograph. What is a myelogram? A myelogram is a radiographic procedure of the spinal cord. It is commonly performed at L2, L3, or L3, L4 interspace. However, it can be performed into the thecal sac around C1, C2. For this exam specifically, the patient is typically in a lateral position. Pictured here is a myelogram. To perform a myelogram, it's usually done under live fluoro. The patient is either prone or lateral recumbent with the spine flexed. It is performed using a non-ionic water-soluble contrast, injecting about 9 to 12 milliliters into the subarachnoid space, and they'll typically use a 22 to 26 gauge needle. However, if a patient has had several back surgeries, they typically use a 25 to 26 gauge needle due to the scar tissue. You'll tilt the table as needed by the performing physician to help the contrast move. The recovery is usually about 4 to 8 hours, and then the patient can be discharged. It is best to keep the head elevated after the procedure to decrease the risk of the migraines that some patients receive after this exam. The exam will sometimes require CT or MRI images as well. Demonstrated here, you can see the vertebral body of L1 through S1, as well as two spinal needles, one being injected into the subarachnoid space of L1, L2, and L2, L3, as well as the spinal cord and conus, and some more anatomy regarding the spinal canal. This is the setup for a myelogram. It does use a sterile field setup, so you will need gloves and a mask in order to do this. They'll numb the area and typically put the needle there and take a scout image so the physician can see if it's in a good place. From there, they'll advance the needle into the subarachnoid space. They know they're in the correct positioning when they see cerebral spinal fluid coming out of the needle. Indications for a myelogram include spinal cord compressions caused by herniated discs, bone fragments, or tumors. It can also be done for spinal cord swelling. It can help show the narrowing of the subarachnoid space. It can also be done to show spinal cord fluid and leaking. It can also be done to show myelogram fluid leaking. It can also be done for any traumas regarding the spine or spinal cord area. Here is a demonstration of a myelogram. You can see the vertebral bodies of L1 through L5, as well as a spinal needle being injected into the subarachnoid space of L3, L4. Some contraindications for a myelogram will include allergic reaction to contrast, asthma, seizures, and headaches. Headaches are common after a myelogram is done, especially if a patient is not having their head elevated following the procedure. Some patients who have seizures, it will increase the chance of having one as well. Evaluation criteria for a myelogram include scout images. All anatomy of interest needs to be included, and the marker does not need to be placed in the anatomy. In images A, B, C, and G, you can see that these are done under fluoro, while images D, E, and F you can see are done under an MRI. In image G, you can see that there's a cyst at the end of the spinal canal, and I think all of these are very good images. Images 1, 2, and 3 are all done under fluoro. 1 is a scout image. 2, you can see is slightly rotated due to the Scotty dogs being shown, and 3 is a true lateral. The only thing I would correct is image 3 has the marker in the anatomy. Everything else looks pretty good. In image 2, you can also see the spinal needle. In this image, you can see a herniated disc. I would just increase my KVP and mass for this image. Everything else looks to be fine. This is a very bad image. It does not include all anatomy of interest. It also has no marker whatsoever. I don't know if it has blockage in the spinal canal since there's spots of contrast. I can only assume that there would be. However, it cut off the rest of the spine, so it's not a good diagnostic image to help us see if there's any blockage whatsoever. Here are some review questions. What is a myelogram? A procedure involving the spinal canal, spinal cord, and spinal nerve roots. B, a procedure involving an injection into the joint space. C, a procedure involving the removal of cerebral spinal fluid. D, contrast images of the spine. Let's start from the bottom. It does not only do contrast images of the spine. Yes, it does show them, but that's not what a myelogram is. C, it does involve the removal of the cerebral spinal fluid, but that's not all a myelogram does. That can just be one indication for it. B, it doesn't do anything with your joint space. That's an arthrogram. So the only correct answer is A. What size needle do you use for a myelogram? You're going to use the 22 to 26 gauge needle. After the needle puncture, what does the radiologist specifically look for in the needle before injecting to assure he or she is in the correct location? A, looks for blood return, which assures proper flow for contrast. B, looks for patient discomfort or comfort. C, looks for cerebral spinal fluid backflow. D, looks at radiograph. Let's start from the beginning. You don't want to see blood return. That's usually not a good thing. You haven't gone far enough or you've gone too far. The patient should be numbed, so you really don't want to look to the patient to see that because they're more than likely going to be uncomfortable and have anxiety anyways. C, looks for cerebral fluid backflow. This is what you want because you're going to know you're in the correct area. Here are my references. Thank you so much, and I hope you learned a lot about a myelogram.